Hello and welcome to this week's episode of GIANT's Healthy Innovators Live TV. Every week, we bring to you some of the leading people from around the world, some of the most dynamic and intelligent and ambitious and accomplished people who are addressing some of the leading challenges in healthcare and taking a leadership role in technology and innovation. So this week, I'm very, very proud to introduce you to two good friends. We have Denise on the call. Hello, Denise. How are you?
I'm doing very well, all things considered. And you, Barry?
Yeah, I'm doing great. Thank you. And so glad you could join us. Thank you very much. And we also have Zain. Hello, Zain. How are you doing today?
Hi, Barry. I'm great. Thanks for having me.
Good stuff. Thank you very much. So on behalf of our many listeners from around the world, this is your weekly episode of GIANT's Healthy Innovators Live TV. Our sponsors are GIANT Health. We invite you to go to the website, www.giant.health, and look at the program for this year. One of the main things coming up is European Health Tech Innovation Week, which is 5 one-day events coming up from the 17th to the 21st of May. These are one-day conferences in Berlin, Barcelona, Stockholm, Paris, and in Liverpool, showcasing some of the finest technology innovation with contributions from some of the leading hospitals and national and international healthcare businesses, some of the best entrepreneurs, as well as investors, management consultants, all of that on top of the platform of everybody working directly in the provision of healthcare. So everybody do please, if you have the chance, check out the GIANT Health website. And we'd also like to thank our sponsors, Vodafone Business and Barclays Bank. We love working with you guys, and we're grateful for your support of these weekly episodes. So Denise and Zain, we've had some crazy times over the past year. We're allowed to mention the C word if you want, but we're not allowed to mention the B word, Brexit. So what we want to do is we just want to talk about what are some of the biggest issues in healthcare? What are some of the greatest challenges in society that overlap with healthcare? And what are examples of some of the innovation which is bubbling up where we're successfully addressing these healthcare challenges? So Zain, you're welcome to start if you want. If you want to make some suggestions, anything you'd like to share with us?
Thank you, Barry. Yeah, I mean, absolutely. I mean, it's been a time of change and a time of adaptation. And I think generally the healthcare ecosystem is stepping up to the challenge and all the challenges we have. And obviously my area of interest is mental health and well-being and you know, pre C word, you know, things were pretty bad. I mean, the waiting time for referrals of psychological therapies was around 6 months on the NHS. Mm-hmm. And obviously things now have got a lot worse, but
sure.
In terms of what we do, we're able to provide fast access to psychological therapists via live video.
Okay.
And in the current NHS work we're doing in Cornwall, we've reduced that waiting time from 6 months to 2 days.
From 6 months to 2 days.
6 months to 2 days. So within 48 hours.
That's extraordinary. No, that's incredibly impressive. And we're keen to hear more about that, Zain. So thank you for introducing that. I think the mental health issue, of course, is unbelievably important. And the vibe I get is that maybe 10 years ago, 20 years ago, 50 years ago, it was the, what do you want to call it? It was the poor nephew of healthcare in general, whereas now it's gaining more recognition as equally valid element of the broader picture of healthcare and wellness. So that's very interesting, and I'm glad you're here and keen to learn more about that. And Denise, likewise, if you want to suggest what are some big challenges in healthcare right now, and maybe examples where technology and innovation have a role to play.
Well, basically, we have all the problems we had before COVID and a whole set of new problems. As Zain was mentioning, mental health, which has never been recognized to its proper level. And I believe that thanks to COVID, people are going to be more able to speak about it. That is one. But inequality, COVID has really pointed out the relationship between level of education and income and healthcare results, despite the efforts of Europe to, let's say, offer a more egalitarian way of doing things. We see then that artificial intelligence will be more and more necessary in order to catch these problems earlier. So that brings up the question of ethics. But haven't we had recently some of the biggest security risks happening in the world of hospital data?
Yes.
My pet area of interest within all of digital health has always been the quality of care.
Okay.
And that is why I'm particularly interested in virtual reality as a therapy, which we can talk about, and which I believe is also the area of interest of
Yes.
Zain. So it's just everything. The good news is that health is top of mind for for all populations. Everybody wants more about it. The good news is that we have to solve some of society's problems through healthcare.
Yes.
Because without health, there is no economy, there is no society.
No, absolutely. There's that famous ancient Roman phrase, isn't there? Health is wealth. And certainly agree with you 100%. And it's interesting what you mentioned, Denise. I mean, of course, we do have the pandemic and we do have enormous new challenges relating to that. But maybe in one respect, there's a little bit of a silver lining, which is that, for example, with telemedicine and the adoption of new technologies in general, for years and years and years and years, all of us entrepreneurs and technology people have been knocking on the door of healthcare. And an awful lot of people in healthcare have said, well, no, thank you, or we don't need it just yet, or maybe one day. And unfortunately, I suppose the terrible catastrophic crisis that we're in right now has catapulted the opportunities for technology and innovation to come to the forefront. And right now, for example, I have had telemedicine consultations with my GP. And that was only the first time I ever had those with her over the past few months. And right now, our GP allows us to take pictures of funny things on our skin that we're worried about and email them to her. And that did not exist at all for me a year ago or 2 years ago or 3 years ago. So I suppose, what's it called? Overnight success comes after 20 years of very, very hard work. But interesting to hear what you mentioned about that and artificial intelligence as well. So Zain, with you, for example, Denise mentioned the issue of AI. Does that impact with you guys? Is there an AI element to your proposition?
Yeah, there absolutely is. So we've actually taken a different approach. Kind of with before in a previous startup life, I'd worked in using AI for kind of medical chatbots to enable people to get some advice. So taking that experience, I realized how in actually emerging markets, especially in the MENA region, there is a lot of demand for healthcare or well-being type solutions where people could get quick access, and actually people have 3 or 4 different mobile phones because they like to have the different models. So
sure,
we were actually approached last year to offer a text-based well-being solution, which is just kind of like the ability to ask a well-being therapist or a psychological therapist some advice via text message. And then so we've started doing that, and it's proven a real success. But as part of that, we do have AI where we give daily advice based on their interest, more kind of as a mental fitness type thing,
right?
Where it's about positivity, it's about resilience, it's about surviving lockdown, things that they're interested in. So they're not just waiting for that message from the therapist. They can actually type something in like, hello, how are you? And they will get a reply back. And watch this space. We're hoping to integrate that into messengers soon. Will be available in the UK.
Yes. Oh, that's extremely interesting. I wonder from an international perspective, Denise, would you say that things are substantially different from your perspective in France? Of course, I'm sure you have a good understanding of the UK healthcare system. Are there any clues or directions regarding addressing challenges or regarding adoption of technology? Any lessons in France you'd like to share with us?
Well, what I see is that digital therapeutics, it looks to me as if digital therapeutics is getting closer to really having its day in the sun, pushed forward. No product, no treatment can get on the market and get a reimbursement if it doesn't have all the data that's required. However, sure, I would think that the judges would have a friendlier eye on these cases that are being brought in, thanks to this general push that we have for digitalness and digital transformation. And we are indeed seeing, it was in the pipeline in France, a software for follow-up for lung cancer treatment had been prepared from the very beginning over a number of years. I hate to say 9 years that the physician behind this was working on it, so that when the patient is sent home from a hospitalization or from just treatment, they will be followed by filling in answers every week, and an algorithm will let the patient and the doctor know if there's some creeping in of the symptoms. We got to get them back there, and they have 3 months reimbursement for this particular treatment. And very recently, it was listed that there are 11 or 12 solutions that are reimbursed in Germany that has put together a platform for this. There are others in France in diabetes, not just cancer, and some other areas. And it's moving ahead in the US. I think that digital therapeutics, and I'd like to make another comment, if I may, which is about the notion of use cases.
Right.
We began by talking about how can technologies help these challenges. The other major trend that I see is the fact that we are evolving, and the VCs are evolving from technology to the use case. It's no longer, well, I mean, you might have to say to them, yeah, I'm in AI or I'm in VR, but it's what are you doing with it? What's the deliverable?
Yes.
So it might be sleep, it might be mental health issue, and within it, you might have a number of different, you might have AI, you might have this and that, might be on a phone, it might be in a headset.
Yes.
But we're going towards use cases. I think that that's a very important thing to acknowledge.
Use cases. Yeah. Denise, thank you. And I think that's a very good point. As an example, you do get early stage businesses often talking about their technology. But from my understanding, and correct me if I'm wrong, you normally do not have people, for example, in a hospital group whose job is to purchase AI, or whose job is to purchase anything like that type of technology. Of course, you have people whose job is to purchase internet connectivity in a hospital, but that's the same as purchasing water and floor cleaner. Those are basic commodities. That reminds me back, of course, in the 1850s and 1860s, when they invented stainless steel. Everybody talked about it, and it was amazing, and it was a big subject, and radical discussions about business models. What are we going to do with stainless steel? But of course, that's embedded now, isn't it? And I don't remember going to a dinner party recently where the subject of stainless steel was high on the agenda. Whereas with like virtual reality or artificial intelligence, or whatever beyond artificial intelligence, these are still exciting subjects. But I think at one day they're going to disappear into fabric of what we do and what we make and what we procure and this type of thing. So that's interesting. Denise, you mentioned digital therapeutics, of course, extremely important. I also just want to mention that a lot of people, I think, listening to this episode from around the world might not be as embedded in the world of healthcare and technology as we are. So could you just define digital therapeutics? And then, Zain, we invite you obviously to add to that.
Sure. As many people have said for e-health or digital health, that we have to go to health. Sooner rather than later, digital therapeutics will just be therapeutics. But digital therapeutics is the fact that we will use digital technologies to improve or obtain a better therapeutic result. So it could be simply having an app. For example, what I was talking about just a minute ago, the app that will enable a physician with regular medicines to improve the results and survival rate for the patient, thanks to this checking in process. That is a digital therapeutic. At the other end, you have virtual reality on a headset, which itself, without necessarily having a complementary, it can have a complementary treatment, but alone, it will procure a clinical result.
Right. Okay. Well, that's very, very helpful. Thanks for the clarification. And likewise, Zain, obviously, we'd love you to pipe in here. Is there an overlap with the theme of digital therapeutics and what you guys are doing? Or are you outside of the, what do you want to call it, the regulated or the prescribed elements of healthcare?
Yeah, so I mean, I like that definition or kind of description. I think digital therapeutics is interesting, and I think you touched on it, both of you, in terms of it developing, what is, in the normal medical world, a therapeutic is a pill,
Yes.
or an operation,
Yes.
or, something like that, an intervention.
Yes.
So I guess, as more entrepreneurs and innovators come up with, their own solutions, we'll have a wider definition of, okay, what is a so-called digital intervention or digital therapeutic? What is that? And it's very interesting.
Yes.
So yeah, I think it's something that's very interesting, evolving. Some of the sleep apps, for example, actually on the NHS guidelines now are considered as a therapeutic. So the one I think to mind is Sleepio.
Right.
So that's on the guidelines.
Right.
That's a guideline. That's on the National Institute of Clinical Excellence guidelines for the treatment of insomnia.
Yes. Yeah.
Which is interesting. It's very interesting because in itself, it's not a therapy, but the way they've looked at it, and I guess the way Sleepio position themselves, is that this is something that can treat insomnia, therefore should be a therapeutic, which obviously it does.
Absolutely.
So yeah, that's all I would add. So it's very interesting, and I think you raised, both of you, some very interesting points.
Yeah.
Absolutely.
I would add that for years, and there still is, there's a huge medical literature always about the reduction in results of treatments that are very, very banal treatment, hypertension, diabetes, quite often claiming that the reason is that the patient isn't taking it properly. And so much of digital therapeutics is directed towards improving or reducing the level of non-adherence or adhesion to treatment. But the one that I mentioned earlier, I like to mention again, is about the fact that the physician would have no way of knowing that the treatment duly taken by the patient wasn't working properly anymore, perhaps because the disease advanced.
Yes.
And our health system would not be able to pick up on it without some data. Another example that I had from a long time ago had to do with the implanted defibrillators and pacemakers, that in France, and probably in most places, there's statutory dates at which the patient would be seen, X number of months after the implant.
Right.
And in fact, just like when you take your car to the garage, it's not that day that the thing goes wrong, it's the next day.
Yeah.
So thanks to digitalness, or thanks to numeric connection, the patient can be brought in at the right time. That is an important part of digital therapeutics.
That's extremely interesting. Yeah, and Denise, thank you for raising that subject. I guess in the theme of adherence, which again, for the sake of our listeners, if you don't have a background in this, adherence is about whether or not the patient is taking, for example, a medication according to the instructions provided to them by their doctor. So maybe you might go to the doctor and you might have an ailment and the doctor recommends you take a course of pills, 1 a day for 10 days. The theme of adherence relates to whether or not you are doing according to the doctor's instructions. You're taking that pill every day for 10 days. Or often what a patient will do is the patient will say, well, it's 5 days later, I feel fine, so I'll just stop taking the pills. I'll throw them out. A limited understanding is that that's actually not what you should do. You should actually follow the instructions that the doctor gave you, whether or not you feel better halfway through the course of the prescription. So I guess with adherence, with digital therapeutics, the adherence is automatic. We just absolutely know as a certainty whether or not the patient is making use of the digital therapy. You can't not engage with the digital therapy without the digital therapy knowing that you're engaging with it, unlike the pill where the doctor and the pharma manufacturer don't know if you're taking the pill or not. So that's extremely interesting. I hadn't thought of that, but adherence is big. Denise, you also mentioned VR. Are you working on any projects in VR currently, or do you want to cite any examples? Also, just in case, tell us what VR is.
Yes. So virtual reality is a technology that has been developed over the past several decades, and it needed other advancements in technologies in order to come into its own. Okay. In particular, a big breakthrough was when Oculus came out with an independent headset that you didn't have to be tethered
Right.
to your computer. That made a huge difference. Now there are others as well, like Pico.
Okay.
And also the apps have to have demonstrated their results. And when you look at the ones that have been through the whole process, there aren't as many as the number that are out there for people to use.
Sure.
So virtual reality, people often advance the idea that the reason why it works is that it really envelops you, it captures your brain, and therefore, if you're seeing something pleasant, it will relax you. It will distract you from pain, although if it's extreme pain, perhaps not so. However,
Sure.
there are good examples. I love to give the example of birth. Women who have the fortune of getting virtual reality headset treatment, I'll call it, in preparation for and then in the last stages of labor, and for whom there is a time acceleration. They may feel like it's only been a few minutes and it's been a few hours. And our project in all of this is to get this kind of information across to potential patients and professionals through a platform we've developed called VR for Health. And on this platform, we are open and ready for partners who would like to develop tech for good initiatives together that demonstrate the value of virtual reality.
That's extremely interesting. VR for Health, what's the website for that?
So vrforhealth.com.
Okay.
We're the first, and it's been very appreciated to have collected and curated videos describing these different indications of VR per medical condition.
Yes, that's fascinating. I wasn't aware of the application for women on the way and into childbirth. So that's extremely interesting. Zain, does that overlap with your world? Are you guys doing any direct virtual reality applications now? It is big in mental health, isn't it?
Yeah, well, we thought about it. I mean, in terms of, as far as I know, in terms of the clinical evidence, I've not heard about the childbirth one. That'd be interesting to know.
Yes.
But in terms of so far the evidence for phobias, some phobias, not all, and for PTSD, post-traumatic stress disorder. But the main reason we've kind of not gone down that way is a personal reason, nothing to do with the technology or the vision. I mean, all that is really, really powerful, I think. But one of our key pillars is accessibility.
Okay.
We want to make mental health as accessible as possible, which is why we don't even have an app. It's, you know, we want to make it very, very simple to access our experts and therapists.
Yes.
And I think at the moment, the price for these headsets is prohibitive for that. But again, that doesn't take away. I think very much VR is something that will come in soon. But at the moment, the cost, I mean, we can't expect our clients to be paying £300 per person for a headset.
Whereas they all have smartphones, or they all have TVs at home, or this type of thing.
Yeah. So I'm sure it will get there.
Yeah.
I'm sure, someone
Absolutely.
Samsung will come up with a cheap way, kind of an affordable way to do it all.
Yes.
Maybe not Samsung, maybe Apple, whoever. I just picked Samsung out of the sky. And the evidence certainly is building up. So I think it's great. And Denise, me and you should definitely speak afterwards. I think I would love to hear your thoughts on because you probably know more about it than I do. But yeah, accessibility is big for us, especially. That's why we've got our low cost text-based messaging model as well, because it's just a really big pillar for us.
Yes. Yeah, I agree that I'm waiting for somebody to come up with the £99 headset, but I would add that if you look at it from a health system standpoint, and you can read a very recent blog article, I interviewed a psychologist named Dr. Gurr. He achieves, in terms of phobias, in 5 or 6 sessions, what it used to take him 5 or 6 months of once a week.
Wow.
Other psychologists send him their patients and then take them back. He takes them over for, let's say, 5, 6 weeks, and they will get over their social phobia. They'll be able to get on that train or plane.
Wow.
And he explained to me exactly, and we talk about it in the article. So I find it fascinating. It's certainly something I would not want to do alone. I'm not crazy about rodents, to be honest, and I would not do this without the accompaniment of a psychologist so that I don't go crazy.
It's scary.
Exactly.
It's scary. I don't know if you've ever tried one. I've put one very rudimentary, maybe 4 years ago.
Okay.
And it was scary. I thought, God, someone can't do this alone. I mean, that was then. I don't know what's available now.
To be honest, I began this by attending there's a great conference that I don't know if they're going to hold it this year, but Serious Games for Health in Europe. And a number of times, at least 5-6 years ago, I would put on their headsets because they had these genius things for rehab. I remember getting into a glass, now I'm not afraid of heights, but getting into a glass elevator and you go like this and you go around and
Wow.
and I thought it was fantastic. Then they had
Yes.
this thing for the eye rehab, like your eyes could shoot at stuff. And that had gotten me going on it. And I have my own headset, but I would invite you to read the blog and you would get some personal.
Please, yeah,
Sure.
that would be very interesting.
Denise, where can we find that blog?
It's part of the site. And in fact, you had told me that I could make a shameless plug, March 31st at 6 p.m. GMT, I will be doing a live that you can sign up for free with a chronic pain patient who has become so enabled and experienced with VR that I'm going to spend the 45 minutes with him discussing.
Yes,
Excellent.
well, that's extremely interesting. We'll make sure to cite the link directly to that at the bottom of the TV show. And we can also promote that further across all of our community and social channels. But that's extremely interesting. I look forward to seeing that.
Thank you.
We've been talking about some very interesting technologies and some applications of these technologies, the so-called use cases, as you say, Denise. What are some issues for the entrepreneur in terms of procurement, in terms of actually doing business? So do you have any experience in that, Zain? If you're creating a new product or a service, is it easy to find customers? Is that a convoluted and painful journey? Do you have any tips or tricks you want to share with our community?
So yes, it's all of that. It is. So I mean, I think the first time you start a startup, and if you're not coming, I think now there's so much startup resources around. I think if you go back like 8 or 9 years ago, there really wasn't. And there's fantastic things like GIANT Health, which is, everyone that can attend must attend and see what's going on. And I'm not just saying that, it's really, really great to see what's happening. I think I personally, again, and everyone has their own way, and it's strange coming from a doctor to hear this, but I really believe in the lean model. And I really believe that you need to get something out there and see what people think.
Yes.
And I think the two, if I was just giving general on my own experience and just seeing what's happened in previous startups as well, the key to success, I believe, is just how quickly you can learn and how quickly you can execute, and keeping your runway as efficient and as long as possible whilst you're doing that.
Yeah, very, very good points. Denise, I don't know if your world overlaps with startups that much, but obviously you're permanently in the middle of innovation land in healthcare. Do you want to share any observations or experiences?
Sure, it does, because I have run a number of startup contests. I've been in a device type startups myself.
Yep.
And I would love to cite, since his birthday is coming up soon, the late Michael Sears as an example to follow. So outstanding patient of the NHS turned product creator. He made astounding advancements in the area of the connected stomy bag with a company called 11 Health that must be a model to follow. If you start with a real pain point lived through by a patient and get the healthcare professionals, which he did, right away connected to him with the nurses, the dietitians, the whole hospital, bringing everyone in and knowing what features you want. He didn't just work on the STOMI. Before that, he wanted to do a connected backpack. I mean, there were many things. His would be the most amazing example of how to get on to success, with a lot of hard work and creating patient ambassadors, but just doing everything right: regulatory, reimbursement, studies, just everything, and always from a minimalist standpoint. To go to Zain's point, this was not the guy who'd go ask for millions and spend them recklessly, not whatsoever. Otherwise, I've been in a lot of situations, and that's what I always tried to do with the conferences that I organize in my other hat, is create opportunities for concrete people to speak about concrete things.
Yes, no, very, very good points. Likewise, Zain, thank you. I think the lean methodology, of course, is profoundly important, and probably internationally recognized as the right way to test ideas and to demonstrate whether or not your hypotheses have a market validation. And I agree with you completely, Denise. And actually, it's lovely to hear you mention Michael Sears, our good friend. And as you know, we had an entire show last year dedicated to him. And thank you for your involvement in that, of course. And we're going to continue the annual Michael Sears Award at the GIANT Health event every year. I have endowed that to continue on an ongoing basis. So I'm glad you mentioned that, and thank you. And always good to pay tribute and to remember the brilliant contribution that Michael made, and the value of what he stood for in terms of patient-centered healthcare and innovation. So good to hear that. Well, look, you guys, we don't have too much time left, I'm sorry to say. In the ideal world, I'd like to buy you another drink and continue this conversation for another hour or two. I'm looking forward to meeting both of you in person sometime very, very soon. But until then, why don't we just spend a few minutes wrapping up, if that's okay? So what we want to do is we just want to talk about the future and incorporate what you're doing and incorporate the areas of healthcare that you're working in or that you're passionate about. And if we can get a message from you about the future, what's coming up for us to look out for, or what are we hoping to see 5 years from now, something about the future, something about what's developing, something about that you're passionate about, and where that's going, or just a optimistic message about the future you'd like to share with us. So Zain, obviously I love what you guys are doing, and so if you want to share with us maybe a roadmap or any vision of the future that you want to share with us, and what we're doing to get there. And you're also welcome to extend your ask to the community. You might say, well, in the future, we're going to do this, and we're also looking to raise some money, or are you hiring? Who in the community that will be watching this TV show do you want to engage with?
Wow, it's like Christmas.
I hope so.
So I think firstly, what I really want to say to everyone is, you know, I think we've all got to believe things will get better. Hopefully we'll all get back to our new normal and do what we do, like, you know, playing football with our mates or whatever it is, going to cinemas and everything. It will come back. And thank you to everyone in the COVID response and everything, all the NHS staff. I think they're real heroes. In terms of what I think, obviously, we believe that we're transforming mental health, not just in the UK, but globally, by making it accessible same day.
Yes.
And I believe that using live video technology and using services like our new messenger service, I think those mediums are going to become the norm. Like Denise mentioned, you know, there's no talk of, no one says e-health anymore. Just like we hope with mental health, you know, these types of solutions will become the norm.
Yes.
I think people will demand that. People will no longer want mental health to be done by charities or volunteers. You wouldn't expect cardiac surgery to be done by a charity. You'd expect it to be done by a cardiac surgeon, and you'd expect it to be done really well.
Yes.
And that's what we want. We don't want this kind of ugly sister. In terms of what our ask, yes, we are going for a serious Series A to take our service global,
Nice.
even more than it is. And also, we are looking for more NHS partners to support our work, bring down their waiting list from 6 months, which we know is a problem across the country. And if you're a good person that is looking for a job, we're always looking for good people too.
Perfect. Excellent. Well, Zain, thank you so much for sharing all of that. Well, as you know, within the GIANT Health community, we know quite literally many thousands of institutional investors around the world with a focus on healthcare. So we should take that discussion offline, and we'd love to help with introductions if we can help. And likewise, Denise, if you have a vision for the future or a program you're working on you want to share with us, and of course, any asks to our international audience.
Well, I think that we can be more relaxed about the advancement or the acceptance of digital health for all the reasons that we mentioned. That kind of fighting to prove that it can work is over in a general way.
Yes.
I do see something new coming up on the horizon as a challenge, which is ethics, because as we automate everything, we have to be really more careful than ever of the biases that we program into it. We're already not aware of the biases that we practiced in just general life, but it'll be even worse if we can program them in towards millions of people and not be aware of it. So ethics will be very, very important, I think, and also for the problem of inequality, trying to make things more egalitarian, and we'll probably also go more towards prevention for all those reasons. As to my ask, we are looking for corporate partners who would like to take on specific niches in the area of virtual reality and explore them together for the benefit. It could be for women with breast cancer. It could be for births, as we mentioned. It could be in the elderly, whatever these segments are, and see what we could do together, building like a tunnel-like or specialized area on our platform.
Yes. Okay, excellent. Well, that's great to hear. I'm certain there's a lot of people in our international community that would like to engage with you. So Denise, thank you for sharing that. And we'll also put your contact details underneath this TV show and on our website, and likewise with you, Zain. But both of you, thank you so much. What an absolute pleasure to speak to you two. And for me, it's humbling, but also incredibly energizing to be in association with people like you that are doing such interesting and important work in healthcare and tech and innovation. I feed a lot off of your passion and your commitment and rolling with all the hardship that comes from being at the forefront of innovation, and your dedication. And I'm sure that will rub off on millions of people. So thank you very much for joining us. And I'd like to thank, of course, our sponsors, Vodafone Business and Barclays Bank. We love working with you guys, and we're grateful for your sponsorship. This obviously has been this week's episode of GIANT's Healthy Innovators Live TV. We invite everybody who's watching this episode to go to the GIANT website, which is www.giant.health. And there you'll see the latest initiative, which is European Health Tech Innovation Week. So the first thing coming up is Denise's event, which we're going to be promoting and championing. But then after that, we invite everybody from the month of May to participate in European Health Tech. That's 5 conferences in Liverpool, Berlin, Stockholm, Paris, and Barcelona. And we'd love to see everybody there. If you want to speak or sponsor or exhibit or get on stage, please contact us. We're always ambitious to support the entire healthcare innovation community. So once again, of course, my name is Barry Shrier. I've been your host today. Thank you for listening. Thanks to our sponsors. And in particular, of course, thank you, Denise. Thank you, Zain. Love having you guys on board, and good luck with all of your important and exciting initiatives. Thank you very much.
Thank you.
Thank you so much.
Thank you, and all the best. Bye-bye.